The following segment is sponsored by Intermountain Healthcare. Pregnant women and new moms may be at risk for peripartum depression or anxiety. Kim Myers is the Behavioral Health Clinical Program Manager at Intermountain Healthcare, and she's also a social worker. She's here to tell us about the signs that moms need to watch out for. Welcome, Kim. Thanks for joining us.
Thank you. Thanks for having me.
Absolutely. I love what we're talking about today, and I think it's so important. First off the bat, I just want to talk about what are some risk factors that contribute to peripartum mood disorder?
Sure. I think the two main risk factors are a family history of peripartum or postpartum mood disorders, or a personal history of having a mood disorder prior to pregnancy or birth.
Okay, and let's talk about kind of the time frames. Why is peripartum and postpartum both these critical time periods?
Sure, because we're going through so many changes, hormones, body changes, changes in relationships happen, and so it's just a time of really intense change, which can trigger things like a mood disorder or extreme stress.
You mentioned stress. Let's talk about stress and how does it play a role in all of this? Because I was pregnant. I remember it plays a huge role. Kind of, you're just feeling a lot of feelings during that time. So yeah, stress is important, right?
Yeah, absolutely. I mean, there's so much going on, so much change. There's also a lot of unknowns. There's a lot we can't control, right? So which leads to sort of that anxiety and worry. And so it's just a really stressful time. Also, postpartum, the stress of not sleeping, of, learning to care for a new baby. All of these things can contribute to the development of a mood disorder.
So many things, so many factors and things too that really contribute to that. Is postpartum depression pretty common here in Utah? Let's talk about that.
Yeah, absolutely. I mean, unfortunately, when we look at maternal deaths, we know that suicide and overdose are the leading causes of maternal deaths in Utah, which are often, really closely related with mental health conditions. And so it's extremely important to have this conversation. And 1 in 8 women after, will experience a perinatal mood disorder. So it's really common.
Wow, that's a lot more common than I think a lot of people realize. I want to talk about the distinction between postpartum depression and baby blues. What is that? Let's talk about that.
I think the main distinctions are the amount of time you experience the symptoms and the severity of it. So they all can kind of tie into sadness, worry, changing in your sleep patterns, questioning your ability to sort of care for your baby, all of those things. But when it goes on longer than a couple weeks, or the intensity is such that you can't really carry out your daily functions of taking care of yourself or being able to take care of your baby, then start the conversation with a provider and see if there's additional supports available.
That's amazing. And speaking of supports, where can people go if they are looking for some of that additional support?
Yeah, we encourage people to first, talk with your OBGYN or your primary care provider. If you don't know where to turn, you can call the Intermountain Behavioral Health Navigation Line at 833-442-2211. If things are escalating and it feels like you're having thoughts of hurting yourself or your baby, or really intense anger or rage, or an overwhelming sadness, visit the emergency department and get some support right away.
Get some help. Those are resources that are available. Thank you so much. It's so great to have you in here.
Thank you. Thanks for having me.